Brought to you by Covered California.
We might be approaching winter, but the most common type of cancer is still a threat. In fact, skin cancer makes up nearly half of all cancers in the U.S., and 1 in 5 people is expected to develop some kind of skin cancer in his or her lifetime. With me now is Dr. Mitchel Goldman from UCSD, as he is every Tuesday, this time to talk about the signs to watch out for and ways you can prevent it. Thank you for being here.
It's great to be here.
Well, let's talk about this timing. It's almost Thanksgiving, so people might be getting lax with the sunscreen. Why is it important to keep this skin cancer conversation going now?
Well, it's important because, as you just mentioned, almost 1 in 5 people are going to get skin cancer. There's 5 million Americans going to get skin cancer this year, and about almost 100,000 are going to get the most deadly form of skin cancer called melanoma. But the reason I wanted to talk about it is the Center of Disease Control just put out a report saying that treatment of skin cancer is up 125% in the last 5 years, as opposed to other cancers, which are only up 25%. And the reason is because malignant melanoma, which was a really bad fatal form of skin cancer, now has a lot of different treatment options, but the treatment options are very expensive, costing upwards of $50,000 a year.
So this is actually a disease that is burdensome to the actual health industry at this point because it's growing at such a rate. Is that fair to say?
It's the fastest growing cancer, and the expense of treating the malignant melanoma cancer is also rising. The good news is people are surviving longer and we're developing greater treatments. But as better treatments are being developed, it costs a lot more money. But the most important thing for our viewers to know is that skin cancer is very treatable, and if caught early, is entirely curable. So if any moles are changing, if you have anything that's bleeding, itching, growing on your body that's different than it should be, that's when you should see a dermatologist. Key thing, if something changes, doesn't heal, and with just a few seconds, your dermatologist or most other doctors now can make an accurate diagnosis. One of the other things that's interesting or important is you don't want to just biopsy everything on your skin. Not only does that cost you money and the healthcare system money, but also leaves you with a scar. And that's why if your doctor says, you know, I really don't know about this mole, maybe or maybe not, that's when you should see a board-certified dermatologist, so that perhaps you can avoid having a biopsy, the expense, as well as a scar.
And you should be having that annual checkup with your dermatologist anyway to look for areas that you can't see, like on your back. What are some of the real risk factors when it comes to skin cancer, and who is most at risk?
Well, the people most at risk are those with lighter skin, those people that have had sunburns, and especially here in Southern California, people that go to tanning salons. It's a tanning salon which the rays are going to go deeper under the skin surface and promote skin cancer, especially the deadly form of skin cancer called melanoma. So the other reason I want to bring it up Thanksgiving time is because this is a time of year people sometimes want to go to a tanning salon. They want to work on their base tan, and that's probably the worst thing that you could possibly do. I'd much prefer people sit in the sun than go to a tanning salon. So even though it's winter time, even though we want to stay healthy, the idea is not to go to a tanning salon. And the last important point is, you know, I have this saying, wives save lives. It's so common for a guy who doesn't look at themselves or take care of themselves to say, hey doc, I'm just here because my wife said this mole is changing and she wanted you to take a look at it. And that's the most common patient I have in my office where I diagnose a new skin cancer. So husbands, if your wives, or guys, if your girlfriends tell you to get a mole checked out, time to get a mole checked out.
I have sent my husband to the office, as you know. All right, Dr. G, always great to check in with you, and we will heed the doctor's warnings for sure. Thanks so much.
See you next week.